Hi there, I'm Dr. Havalana. I'm the medical director for the Center for Weight Management at Longstreet Clinic, and I'm here with Mercedes Hall, one of our nurse practitioners, Dr. Ganguly, our endocrinologist, and Miss Otia Morris, another nurse practitioner here. We're answering questions today about determining the best weight loss option that's for you. So one of the common questions I get is, how do I lose belly fat? Well, belly fat's hard. Certainly belly fat can come along with with stress, with poor sleep. Certain medications cause belly fat to accumulate. Artificial sweeteners can cause belly fat to accumulate. We look at a lot of different reasons why it happens. Losing it, however, requires examining all of these possibilities and looking at lifestyle, behavior, diet, exercise, the whole lot, to determine how much belly fat it needs to be lost and how quickly we can lose it. Dr. Ganguly, what if we only need to lose 20 pounds?
Sure. So this is a very common scenario that we see in our clinic. 20 pounds means different things to different people. Someone who weighs 200 pounds, a 20-pound weight loss would be 10% of their weight, which could certainly impact the control of their medical conditions. So if they have hypertension or diabetes or sleep apnea, all of these things could either be resolved or improved with a 20-pound weight loss, which equates to 10%. If someone, however, is maybe going through hormonal changes, for example, a very common scenario is a woman in perimenopause or menopause who may have had a normal BMI, BMI of 23, 130 pounds, and has gained 20 pounds during menopause. That extra 20 pounds is very, very distressing to them. So how do they go about losing this? Well, we have a lot of options. The cornerstone of weight management is always lifestyle modification, diet and exercise. We have a medical weight loss program. There are medications as well, and it all really depends on what the starting BMI is. But I think we should talk a little bit about our medical weight loss program. Mercedes, can you tell us a little bit about that?
Absolutely. So in our medical weight loss program, we have different plans depending on what the weight loss goals are from the patient. And so we have different plans. The first one is called very low calorie diet, in which we're using 4 meal replacements that are high quality protein meal replacements a day, which the expected weight loss is anywhere between 3 to 5 pounds a week, which it accounts for about 20 pounds in a month. The second option is called low calorie diet, in which we're using 3 of those meal replacements, and we do 1 healthy meal, and we'll give you the guidelines to the patient of what that healthy meal looks like, but again, high protein, low carbohydrate meals. And the expected weight loss is anywhere between 2 to 3 pounds a week, which accounts for about 12 pounds in a month. The third option, we have patients that have sensitivities to the meal replacements, or they're intolerant to meal replacements, so we may do food-based, or we can use 1 or 2 meal replacements in combinations with those healthy meals. And the expected weight loss with that plan is usually 1 to 2 pounds a week, so at about 8 pounds in a month.
So Tia, can you participate in the medical weight loss program, say, and then maybe go to surgery afterwards?
Absolutely. It's actually ideal because in the medical weight loss program, you are practicing things that you'll have to practice to maintain weight loss after surgery. So you're looking at a better diet, you're making better choices with food. High protein meal replacements are definitely something that's introduced in the medical weight loss plan, and so you'll be doing those as well when you're prepping for surgery, be it a sleeve or a bypass. So kind of getting into the habit of eating better, practicing sleeping better. If you're on any medications that are causing weight gain, we can probably get you off of those before surgery, so you might actually be losing weight before you have surgery, which is really good for folks. So yes, you can participate in both programs or start the medical weight loss program before you have surgery.
And I tell my patients that they can stay on the plan as short as 1 month to lose the 20 pounds, or they can stay on it for over a year. One of my most successful patients has lost over 100 pounds and looks just like a surgical patient. We cured his diabetes, we cured his hypertension, and we cured his chronic kidney disease, which is the first time I've done that in 28 years. So it can be a very successful plan for patients as soon as we evaluate them for it. Do they have to stay on the meal replacements for the rest of their life? Absolutely not. It's not the thing that we don't want them to be addicted to. It's not, we don't want them to think of it as being the fix. You know, it helps them like a power tool to kind of get things done in a shorter amount of time, to feel the results, to actually know how your body is going to feel better without the excess weight. And have more energy when you're on the meal replacements. But certainly it teaches them, gives them an outline of how they should be living, so that eventually they can get off the meal replacements, learn how to eat themselves, take care of their half of the disease while we take care of the other half.